Welcome to the YouTube live book reading of Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. I'm your moderator and narrator, Uriel Riley. Welcome, YouTube. Peace, peace. Happy Sunday. So, we pick up in this wonderful, masterful book, page 80, at the top. Chapter 3, The Mechanics of Ventilation. Here we go. Classification of positive pressure ventilators. There are 4 physical parameters that must be dealt with whenever gas is moved in and out of the pulmonary tree: volume, flow, pressure, and time. Whenever a volume of gas is displaced over a period of time, a flow is developed. Since this flow moves through a series of tubes and into a second confined space, a pressure is produced. Additionally, ventilation of the lungs entails a cyclical movement of air in a to and fro manner. Therefore, the time component of the directional flow is important. There are 4 mechanical parameters that must be dealt with whenever ventilation is to be provided by a machine. There must be a mechanism for beginning the inspiratory cycle, some means of providing the force necessary to move the gas, a method of providing for the end of inspiration, and a means of providing for the expiratory phase. Ventilators are universally classified by the physical parameter that ends the inspiratory cycle. In other words, a volume machine is one in which inspiration ends when a preset volume of gas is delivered. A pressure machine is one in which inspiration ends when a preset pressure is reached. A time machine is one in which inspiration ends when a present time has elapsed. And a flow machine is one in which inspiration ends when a preset flow rate is delivered. In the United States, it is a reasonable to combine this basic classification of ventilators in 2 major types: volume time and pressure. Although there are numerous sophisticated pieces of equipment which are combinations, it is clinically meaningful to separate the machines into these 2 basic categories. Volume time machines. Welcome, YouTube. Hi, it's Heart Love. Thank you so much for reading books with us. We're doing it. This is the information of self mastery, right? Clinical application of respiratory care. And this is MCAT material, masterful material. Thank you for reading and thank you for the likes and subs. We're pushing to 500 where we read books. So you'll see in the playlist, this is the next reading. And in chapter 3, we are the mechanics of ventilation. This will be the completion reading of chapter 3. So thank you for being here. Hi, it's Heart Love. Seni Señora. Je t'adore. Volume time machines. For a machine to deliver a preset volume, it must have internal power sufficient to deliver the volume regardless of the presence of external forces. This is accomplished by building into the machine a high internal resistance, which allows for the development of a high internal driving pressure. This makes the machine relatively insensitive to pressure changes on the patient end of the circuit. This classification of volume limited machines includes most of the time cycled ventilators in use today. The advantages of volume time machines are primarily: 1. The volume of gas delivered is reliably controlled. 2. Volume delivery remains constant despite pathophysiologic changes. 3. They are far easier to adapt to various monitoring devices. And 4. They are adaptable to most variations in airway pressure maneuvers. And 5. A consistent inspired oxygen atmosphere can be easily maintained. The disadvantages are primarily: 1. They may provide excessive intrathoracic and airway pressures, and 2. They are expensive. In general, these are the machines of choice for long term ventilatory support. See chapters 22 and 23. We're at the middle of page 81. Thank you so much, Highest Heart Love. Thank you so much for reading books with us. That's what we do in this corner of YouTube. Read books and learn from masters. Here we go. Clinical application of respiratory care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Second edition, 1979. MCAT material. Mastering ourselves. Thank you for being here. Pressure limited ventilators. In order to readily respond to pressure changes at the patient end of the circuit, the pressure limited ventilator must have a very low internal resistance. This classification of pressure limited machines includes most of the flow cycled machines. Advantages of pressure limited machines are primarily that: 1. They are small, portable, and inexpensive. 2. They cannot deliver excessive pressures to the patient's airway. And 3. They are readily amenable to assisting ventilation. The disadvantages of pressure limited machines are that: 1. They tend to provide an inconsistent ventilation since the volume delivery is variable, and 2. They may not maintain a consistent oxygen atmosphere since most of these machines adjust the FiO 2 on the basis of the Venturi mechanism. See Chapter 7. The pressure limited machine can be counted on for consistent ventilation only in patients who have no pre existing pulmonary or thoracic disease and who will not resist mechanical support of ventilation. This type of machine is best suited for the patient in need of short term support and who fulfills the criteria just discussed. Expiratory cycle. Peace, Lucy. Highest heart love. Thank you so much. I know. And we doing it for free. This is a $3,500 book, and it's like taking a course for your MCAT. So we're reading this all. That's all I do on this part of this YouTube, like it's peaceful. I come on here to give everyone a sense of peace and that they can just tune into, and say, let me just breathe. And so breathing is part of, my work and doing breath work. And this was available for us to manifest. we manifested this together, this book, to be able to give to everyone. Isn't it beautiful? Thank you so much for being here in the world of the love life, right? Peace, peace. The pressure limited machine can be counted on for consistent ventilation only in patients who have no pre existing pulmonary or thoracic disease. This type of machine is best suited for the patient in need of short term support and who fulfills the criteria just discussed. Expiratory cycle. We're at the bottom of page 81, chapter 3, the mechanics of ventilation. Most of today's ventilators provide the expiratory phase by opening the system and thereby the patient's airway to the atmosphere. By the process of elastic recoil, the chest wall and lungs provide the driving pressure to create airflow out of the lungs. This can be considered a constant atmospheric pressure generator, since the em- emptying of the patient's lungs have no real effect on the pressure in the atmosphere. Thus, we have a gradually decreasing intra-alveolar pressure within the patient's lungs, providing the driving pressure between alveoli and atmosphere. It is possible to place an injector type system to create a subatmospheric pressure within the circuit during the expiratory phase or negative pressure, right? Negative pressure, expiratory phase. Although this method was popular several decades ago, it is now known that this method of expiration causes early collapse of small airways and trapping the air within the alveoli. A resistance may be placed at the exhalation port, resulting in prolonged airway pressures during expiration. This is known as expiratory retard. See chapter 23. A positive and expiratory pressure, or PEEP, PEEP, can be placed on the expiratory port so that the airway pressure never returns to atmospheric pressure. See chapter 24. Inspiratory driving mechanism. Although it is desirable to keep the complexities of the ventilator mechanics to a minimum, it is necessary to have a basic understanding of the two primary types of generators which are used in clinical practice today: the flow generator and the pressure generator. The constant flow generator is the type of most commonly found in the volume and time limited machines. The mechanism provides a constant flow of gas as long as the inspiratory cycle lasts. The pattern of flow delivery is unchanged regardless of the lung and chest wall characteristics. The constant pressure generator is essentially a mechanism whereby a constant pressure is produced throughout inspiration. The flow delivery will obviously be affected by the pressure being developed in the patient's thoracic cavity. The initial flow values are the highest and then progressively decrease in exponential fashion as the alveolar pressures increase. Thus, it is difficult to maintain constant ventilation since the type developed driving pressure of the apparatus is in the same magnitude of pressure range as the lung alveolar pressures. Any disease process causing decreased compliance or increased resistance will compromise the capability of the machine to deliver adequate volumes. And see, this is what we see with COVID, right? So before that, there was SARS, and these are respiratory diseases and respiratory affecting problems, right? And so I guess giving this information out is just to also reinforce the basics of anatomy and how our bodies work, right? So when we're talking about this stuff and driving force and reinforcing and the volume increase, we know now with the CPAP, right? You put it on and it's monitoring all of that. I like to put a clear quartz crystal in the base where it uses the water, right? And this helps to also filter and generate. So there's a big gem. Ding! Especially dealing with any type of respiratory diseases or ailments. Thank you so much for being here. Hi, it's Harlow. Thank you. The initial flow values are highest and then progressively, yeah. The pressure generator frequently utilizes a Venturi mechanism to provide various concentration of oxygen. This makes the concentration of oxygen delivered variable with the flow rate. For detailed information concerning ventilator function and physics, the reader is referred to several excellent reviews on the subject. Applying positive pressure ventilation. Page 83 at the top. Thank you so much. Applying positive pressure ventilation. Now that we have presented a basic description of pulmonary and ventilator mechanics, we are ready to take a simplified look at the complex interrelationships that occur when positive pressure ventilation is applied. Table 3.1 states four essential relationships in mathematical form, and as an aid to those who find the formulas helpful. We shall discuss these four relationships in non mathematical terms. 1. Recall that compliance and static phenomena is a description of the relationship of the volume delivered divided by the pressure developed because of elastic recoil. Resistance, a measurement of dynamic phenomenon, is dependent upon the driving pressure in relation to flow. 2. The ventilator is a machine which provides a supraatmospheric pressure at the mouth. The actual driving pressure during inspiration will be the result of the pressure being generated by the machine in relation to the pressure being developed in the alveoli. 3. Alveolar pressures increase as volume is delivered to the lung. The resultant alveolar pressure will be dependent upon the volume delivered in relation to the lung compliance. 4. The flow generated in the airways by positive pressure ventilation is determined by the developed driving pressure in relation to the total resistance in the system. In other words, when no driving pressure exists, there will be no flow. As the driving pressure increases, the flow will increase in relation to the resistances present to that flow, meaning what type of blockages that exist, right? With these four relationships clearly in mind, it becomes possible to consider the mechanical properties of the lung in relation to a ventilator. From this point on, reference to the system means the lungs and the ventilator. And here we go, table 3.1 that they just spoke about and described. Here we go. Thank you so much for being here and reading with us. Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. As you see, table 3.1, it's the positive pressure and lung mechanics, right? And it says the delta P equals driving pressure. So this is for a mathematical formula that you would take on the MCAT, okay? And PG, pressure generated, right? And then P AIV or ALV, which is P pressure in alveolus. And then R total equals the R being airway, all right, or R ventilator. And so one, the compliance is delta V over delta P, which is resistance equals delta P over flow. Two is delta P equals PG minus P alveolus. Okay. Three is P alveolus equals volume over compliance. And four is flow equals PG minus P alveolus over R. Show you just again one more time. All those taking notes and then it's possible when we're healing ourselves and helping to heal others, right? That's why we do this. Thank you so much for being here. Thank you, Lucy. Highest heart love. Oh, I love reading too. Yes, love to all the book lovers, all the whole community. That's what we are part of. And so I was telling someone this the other day. You know, I told my daughter this a long time ago. She loves to read, but we're reading information and knowledge and wisdom, right? And we know we're not guessing. We can say, this said this, especially when we're dealing with facts in anatomy, right? And even in that case of nonfiction or fiction, right? You can say, this person wrote this, and it's a fact. So now you know, you're not guessing. You know, and that's why I love readers. I honor you so much. Thank you so much, Lucy. Hi, it's Heart Love. Figure four. Figure 310 depicts compliance characteristics of the system in relation to volume and pressure. As previously stated, this is a linear relationship in the working range of the lung. The diagram demonstrates that the various changes in volume and pressure are proportional. The measurement of this change without regard to time is called compliance. If time relationships are taken into account, we are dealing not only with the ultimate volume delivered and its resulting pressure, but also with the moment to moment change in volume and pressure. This relationship of volume, pressure, and time would result in a curvilinear relationship as shown in figure 311. This closed loop describes the dynamics of the system. To make this point clearer, let us consider the delivery of a given volume of air into the lung in terms of both statics and dynamics. If the volume is delivered with enough time allowed for complete cessation of movement of air, the static relationship exists. Therefore, the pressure measured would be purely a resultant of the volume and elastic. recoil properties of the lung compliance. However, if the pressure measurements are determined as the volume is being delivered, the resultant pressure measurement is a reflection of not only compliance properties, but also of the factor of resistance. In other words, since a static relationship is not present, there is a resistance factor related to flow in addition to the lung compliance factor. Thus, for the volume delivered at the point in time, the pressure measured is greater than it would be for the same volume once a static condition had been reached. Woo! Ding! So powerful. Mm, mm, mm. You gotta let some of this information sit. That's why I even pace the way I do with reading these books because, you know, it's not just reading it, it's embodying it. You embody the work, right? We don't just read it, we let it sit in, we let it marinate in peace. All greatness happens. So here is figure 311, what was just talked about, and we had looked at 310. Here's 311, and it said with the volume in liters, all right, and then expiration and inspiration, and pressure centimeters H2O, all right. It's the volume pressure. Clinical application of respiratory care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Second edition. Thank you so much for being here. So, says Figure 311, volume pressure relationship secondary to the delivery of a volume of gas into a model lung. Point A represents zero flow at an expiration. Point B represents zero flow at an inspiration. The curvilinear line AB represents the inspiratory pressure volume relationships which occur as the volume is being delivered. Curvilinear line BA represents the expiratory dynamic relationship. If inspiratory flow is stopped at point C, the pressure volume relationships will change from dynamic to static as the flow approaches zero. The dotted line CD represents this change from dynamic to static state. Note that for the same volume at point C and D, the pressure is less in the static than the dynamic circumstance. Awesome, awesome. Okay, and then here's figure 312. Before we move on, at the top of page 85, right? Thank you so much for reading books. Highest heart love to all my mods, all my friends and family. Thank you so much. We're doing it. We are doing it. Reading master material to the people again, right? In peace, bringing the people peace. Live from the light here in LA. So, figure 312, all right, says the time constant exponential decay curve. See text. Flow time curve obtained under the condition of a constant pressure generator. The length of the time constant intervals, T, plotted along the horizontal axis, is dependent upon the resistance and compliance characteristics of the lungs. T equals RC. The curve demonstrates that the initial flow at time, OT, the initial time is highest, progressively decreasing in a predictable fashion. The exponential decay curve as the driving pressure delta P equals P generated minus P alveolar is reduced. In the same manner, the amount of volume delivered in each successive time constant interval also progressively decreases. End of time constant 0. And initial flow 100%. And percent volume delivered 0. And then 1, 37% flow, initial flow. And then volume delivered 63%. 2, 13.5% initial flow, 86.5 volume delivered. 3, 5.0 initial flow, 95% volume delivered. 4, 1.8 initial flow, volume delivered 98.2% volume delivered, and 5.7 initial flow percent, and 99.3 volume delivered. Thank you so much. Oh my gosh. Thank you, Highest Heart Love. Lucy, she said you were the number one reader. Highest Heart Love, thank you so much. I really love reading to you all. That's why I come here and do it. Thank you so much, Highest Heart Love. Peace, Isaac. Thank you so much. He said I'm the best YouTuber. Highest Heart Love. Thank you so much. I want to show you again. This is a very high level book. That's right. This is a mastery level book, and we're reading it. Clinical application of respiratory care. We're reading it together. We're pushing the 500 likes, subs on this channel, reading books. Thank you so much for being here. The clinical importance of describing these mechanical properties is that for a given driving pressure created by a ventilator, the volume delivered and the flow pattern will be the result of the resistance and compliance properties of the system. This interrelationship becomes important since it involves time and is characterized by a term known as a time constant. The actual numerical value of a time constant gives a measure of time necessary to deliver a given volume into the patient's lung. The characteristic of the time constant relationship turns out to be an exponential decay curve as seen in figure 312. Using a pressure limited ventilator, the relationship shows that the initial flow is greatest because driving pressure, mouth to alveolar pressure, is greatest. This flow will decrease with time since volume delivered to alveoli increases alveolar pressures and thereby decreases driving pressure. The rate of decreased flow is dependent upon the resistance and compliance properties of the lung. Quantitatively, 63% of the volume will be delivered in the first time constant. During the second time constant, less volume will be delivered, 23.5%, with a total of 86.5% delivered by the end of the two time constants. 95% of the maximum volume which can be delivered will be delivered within three time constants. The essential points to remember are: 1. For a machine to deliver given volume within a given time, a minimal driving pressure must be produced. 2. The driving pressure developed will determine the maximum volume that can be delivered to the patient. 3. The flow will progressively decrease with each instant in time. The rate of decrease determined by the compliance and resistance factors of the system. And 4, 95% of the maximum volume will be delivered within 3 time constants. We did it! Yes! We did it together! That's the completion of chapter 3! We did it again! Woo! Yes! Clinical application of respiratory care. When we reconvene, we'll pick up at page 87 and start chapter 4. We did it. Clinical application of respiratory care. Self mastery knowledge so we can heal the people and heal ourselves. You know, the lights of the world. We are the light workers in the world doing it. And we're doing it for free, right? That makes it even better. Hi, it's Heart Love. Thank you so much for being here. Give a shout out to all my friends and family. Lucy, thank you so much. Isaac, we did it. Thank you so much. Love Water. To all my friends and family, all my mods. Might have to make you guys a mod. Thank you so much. Mm, love you. Live from the light. I love you. I love you. I love you. Thank you so much. Thank you for reading with us. All right. Oh, yes. Thank you. Oh, my goodness. So honorable. Thank you so much. We do. We do it right for the people always. Thank you. All right. I will see you soon. When we reconvene, we'll be back. Chapter 4 is on deck, right? Yes. Thank you so much for the hearts. I see all the love. Hi, it's Heart Love. I love you. I love you. Thank you so much for reading books. Hi, it's Heart Love. I'll see you soon. Peace.